Welcome. My name is Heather Brown. I am the nurse with your shoulder and upper extremity surgery team. Thank you for taking the time today to prepare for your total shoulder replacement surgery. Thank you for choosing MaineHealth for your care team. We are all very fortunate to have so many excellent hospitals here in the state of Maine. However, research indicates when making the decision to have joint replacement surgery, you should choose a hospital and surgeon who performs the surgery often. As you can see, we do that each and every year. We did more than 2,500 total hip, knee, and shoulder procedures last year, using state-of-the-art procedures that led to faster recovery and lower readmissions. We do have many certifications, but one we are most proud of is from our Joint Commission honoring our good work with a gold certification, the highest award for hip and knee surgeries, and we are currently in the process of obtaining gold certification for our total shoulder replacement program. Goals for this online education session will include reviewing the steps for surgery to help you feel as prepared as possible for your upcoming surgery, and to provide answers to any outstanding questions that you may have. These pictures illustrate the difference between a primary and a reverse total shoulder implant. Your surgeon will have discussed with you which implant will be used during your surgery. Your surgical experience will involve an entire team of people. This team begins with you. We encourage you to invite a family member or friend to be your helper before and after surgery. Your surgeon and his team will assist you along the way in collaboration with the Joint Replacement Center staff, including nursing, care management, and therapy services. Your helper's role will be to act as your second set of eyes and ears both before and after surgery. They will provide you with encouragement and positive support during this time period. In preparation for your surgery, please review the patient education folder you were given in the office. If you have not yet been provided with one, please contact me at the office and I will be happy to mail one out to you. This packet is broken down into 3 sections: about your surgery, getting ready for joint replacement, and after your surgery. You will also be mailed a copy of your surgical appointments, pre- and post-operative. Please contact the surgeon's office if any of these dates and times need to be changed. Keep this mailed copy in your folder as you will need to refer to it often. Also included in the folder will be a prep planner, which you will use for note-taking when you complete your anesthesia prep phone call. You will receive a phone call from the anesthesia prep department within a 30-day window to surgery. The sooner you are able to clear through anesthesia, the less likely we are to have any delays getting you prepared for your scheduled surgery date. Please have a paper and pencil ready, as this call typically takes between 15 and 30 minutes. Your history and physical appointment will take place at the South Portland office location on Gannett Drive. This appointment is either with a nurse practitioner or a physician assistant who works closely with your surgeon. At this appointment, they will review your medication, health history, sign consent for surgery, perform a brief physical exam, and review any additional questions that you may have. Please have your helper attend this appointment if possible. Mary Sexton Sands is an invaluable resource nurse care manager who will be available to assist in bridging the gap between the office and hospital setting. She can be contacted to assist with any discharge planning needs and will collaborate with the hospital staff to ensure safe and successful discharge planning. In the weeks or months leading up to your pending surgery procedure, keep doing what you're doing, but don't overdo. Remember, it is important to continue a healthy diet, rich in proteins, and to stay well hydrated. If you require any vaccinations, such as a flu shot or shingles vaccine prior to surgery, those should be scheduled 2 weeks in advance to your surgery date and avoid being administered in the surgical extremity. Lastly, be informed, ask lots of questions, and share information you feel is important. Your participation in your surgical experience is vital for a healthy outcome. If you smoke, please take measures to stop. It will slow your healing, which we want to avoid. If you need assistance with quitting, please let us know so that we may assist you. It is important that any chronic medical conditions are under control. If you have any concerns, please reach out to us so that we may assist you in getting you the help that you need. Most of all of our patients are discharged to home after surgery. Please be sure you have the appropriate support set up to make this a success. Our office will be reaching out to your primary care provider as well as any specialty physicians that may be involved in your care. Please get your medical clearances done as soon as possible. Do them before your history and physical appointment, if at all possible, and ask to have the results faxed to your surgeon's office right away. You most likely have had many weeks between the date you first visited your surgeon's office and made your decision to proceed with surgery until you are seen for your history and physical. Please get these appointments scheduled and completed to avoid any delays. Share with us any medication changes so that we may update your records. A few things you might want to consider when preparing your home as best as possible prior to surgery. Organize your living space so that objects are within reach. Set up a recovery area in your home that is comfortable and easily accessible. Prepare meals in advance and stock up on non-perishable items. Line up care for animals and pets as needed. The night before surgery, you may want to take a few minutes to review your paperwork and instructions that were provided for you. Remember to pack your photo ID, insurance card, and credit card that you may need to pick up post-operative prescriptions. Follow your instructions regarding showering with Hibiclens and benzoyl peroxide prior to surgery. Please remember not to shave or use hair removal products. You do not need to mark the surgical area, as your surgical team will do so for you on the day of your surgery. Please remember nothing to eat after midnight. Stop clear liquids at the time you were directed to do so by your anesthesia during your prep phone call, which is typically 4 hours prior to surgery. These are important directions. Failure to follow these directions can delay and/or cancel your surgery. Also, take a moment to relax and try and get a good night's sleep. The day of your surgery, please shower as directed by your surgeon's office with the Hibiclens and benzoyl peroxide. Again, clear liquids only until the time you are directed to stop. You may take a small sip of water with any medications you were told to take the morning of surgery. If your surgery is scheduled on the Bramhall campus, please do not bring any of your medications to the hospital unless you are specifically directed to do so. If your surgery is scheduled on the Scarborough campus, please bring your regular home medications as directed to do so. There are a few items you should consider bringing with you on the day of surgery. If you have a CPAP or BiPAP breathing machine, please bring it with you as instructed. Again, you will also need your insurance information, a photo ID, and a credit card for payment of post-operative medications at the pharmacy upon discharge. Bring any personal toiletries, comfortable clothing, and shoes. Remember, the rooms may either be hot or cold, so please be prepared for anything and remember to pack appropriately. The facility will also have warm blankets, so please ask if you need one. Please watch the weather reports days leading up to your surgery. Surgeries are not canceled, so plan on traveling down the day before if coming from a distance as needed. You will be asked to arrive 1.5 hours to 2 hours prior to your scheduled surgery time. The requested arrival time will be detailed on your paperwork. If your surgery is scheduled at Maine Medical Center Bramhall campus, you will proceed to the main entrance for free valet parking. For those having surgery at the Scarborough Surgery Center, there is no valet parking as the parking lot is in close proximity and located directly outside the building. Maine Medical Center Bramhall patients will be asked to check in with the admitting department and then be escorted to the surgical area. Scarborough surgery patients will be checking in at the front desk and then also escorted to the surgical area. Included on this slide is a video link which you may watch for an overview of the Scarborough surgery facility and check-in process if you choose to do so. 2 family members and/or friends may remain with you as you wait for surgery. After the admission process, you will enter into perioperative care. Here, nursing staff will assist you in getting you ready for surgery by starting an IV and taking your vital signs. You will also meet with your anesthesia team and see your surgeon. The surgery itself will last approximately 1 to 2 hours. Please remember to let our staff know who to contact when your surgery has been completed. The phone call may display as a blocked number or a spam call, so please be sure to make your helper aware so that they do not miss the phone call. Anesthesia will be discussing your specific type of anesthesia during your history and physical visit. Many patients will receive general anesthesia with a preoperative nerve block. General anesthesia renders you unconscious so you don't feel or remember anything that has happened. The nerve block is a treatment that blocks sensation in the shoulder and upper arm before, during, and after surgery. This will aid with your post-operative pain control. Please ask questions at the time of your history and physical visit or your anesthesia prep call if needed. Following your surgical procedure, you will wake up in the recovery room. Typically, patients will remain in recovery for 1 to 3 hours. Please remember everyone recovers from anesthesia differently and times will vary. After 1 to 2 hours, you will be able to see your family for a brief period of time just as soon as your nurse feels that you are ready for visitors. Please note, you will still have equipment hooked up to you to monitor your heart rate and oxygen levels. You may also have oxygen on to assist you as you wake up. You will have an IV for fluids and antibiotics, and although rare, you may have a catheter to drain your bladder. Once you have recovered from anesthesia sufficiently, you will be transferred to your hospital room if you need to stay overnight. Your nurse will be there to greet you. You may initially feel drowsy, and you will be encouraged to sip and eat a light meal when you are feeling able. Even though you may feel strong enough to get up alone, please ask for help. A nurse or a therapist will work alongside you to assist you with mobility and exercise instructions. Our goal after surgery is to make sure that your pain levels are tolerable. Remember, each and every patient will have a different level of pain tolerance. We will ask you to rate your pain using a 0 to 10 scale, where 0 is no pain and 10 is the worst pain that you can imagine. We will want you to set an acceptable goal based on the 0 to 10 scale. Many patients feel a 3 to 5 range is a tolerable level. We will refer to this scale frequently when assessing your pain. Helping you manage your discomfort is very important to us. Most shoulder patients will have little to no pain while in the hospital. However, if you are experiencing pain, please speak up and ask for medication. Pain medications may make you feel weak, dizzy, or sick. Make sure that you do not take medications on an empty stomach and that you stay well hydrated. This will aid in minimizing the side effects. When your pain is tolerable, you are able to rest well, do your exercises as directed, and ensure an easier recovery. Other comfort measures you may find beneficial along with pain medications are relaxation and deep breathing, distraction, and repositioning. We will encourage you to ice frequently, 20 to 30 minutes on with at least a 20-minute break. Please remember, never apply ice on bare skin. You may develop some swelling post-surgery, and we may instruct you to elevate your arm while lying down. You will do this by placing a pillow underneath your arm while remaining in the sling to just gently raise your arm above the level of your heart. We may also encourage you to make a fist with your hands and make a squeezing motion, along with performing gentle rotational exercises of your wrist clockwise and counterclockwise. These simple yet effective exercises will help decrease swelling. If you have any concerns of swelling, please always feel free to call the office for further discussion and direction. Following surgery, your arm will be placed in a sling and swath to keep your arm immobile during the initial post-operative phase to promote healing and ensure success after surgery. You may remove the sling for bathing and dressing, but it is important to otherwise wear the sling as instructed, including while sleeping. Your surgeon's office will let you know when you may stop wearing the sling permanently. Side effects of pain medications may include constipation and/or nausea. Constipation may be treated with over-the-counter medicines and increasing fiber in your diet. Again, it is important to remain hydrated. Please be sure you take your medications with food to reduce the chance of nausea occurring. If you are unable to easily resolve these symptoms, please contact the office for further guidance. We take risk prevention as a serious part of your surgical care. Prior to surgery, you will be asked to wash with 2 antimicrobial soaps as part of our infection prevention protocol. You will also be administered preventative antibiotics during and after surgery. Our goal is to mobilize you as soon as it is safe after surgery. Staff will be encouraging you to get up and out of bed quickly after surgery to speed your recovery and prevent blood clots. Many patients will be directed to take 1 81 milligram aspirin in the morning and 1 in the evening for 2 weeks after surgery as part of our recommendations for preventing the possibility of blood clots. If you were previously taking any blood thinning medication prior to surgery as part of your daily routine, we would resume those medications as soon as possible. Ag is the symbol for silver. Silver produces an antibacterial effect which reduces the opportunity for an infection. This dressing has a fluid locking technology which helps wick fluid away from the skin and pulls it into the dressing. This surgical dressing is intended to stay in place until your first follow-up appointment in the surgeon's office. If you notice fluid on the bandage that touches the adhesive edge, please call the surgeon's office and discuss if the bandage may need to be changed. If your discharge instructions state that you may shower, this bandage is water resistant and will allow you to do so post-operatively just as long as the dressing remains sealed and does not appear to have any adhesive issues. You do not need to cover the bandage while showering. Your surgeon, nurses, and therapy team will provide you with exercises to follow at home to promote a safe and successful recovery. They will assist you with review of your discharge plan and preparation for your departure home. Nursing and therapy will emphasize early walking as key to promote healing and the reduction of complications. For Maine Medical Center Bramhall campus patients staying overnight, your therapist will post your therapy schedule in your room on the whiteboard, typically the evening of surgery, for the next morning prior to your discharge. Please remember to order your meals around that therapy schedule when possible to avoid eating a cold meal. Those patients being discharged the same day as surgery, you will receive therapy instructions from the nurse as part of your discharge. Please invite your helper to join you to listen while you receive discharge instructions. We welcome and encourage their participation. Upon arriving to your room, your nurse will show you your call bell. Nursing and hospital staff want to provide you with the best care possible, so if you need something, we encourage you to please use your call bell for help. Your nurse will also provide you with detailed discharge plans, including instructions for therapy, follow-up care, and discharge medication. Your helper should be available to listen to these instructions with you if possible. If your hospital encounter involves an overnight stay, a member from the care management team will help assess your needs for discharge and begin to formulate a plan in collaboration with your entire care team. If you require visiting nursing and home therapies after discharge, they will also assist in arranging these services for you. For patients being discharged to home on the same day as their procedure, your nurse will assist in addressing any needs to make your discharge safe. Please be sure to have someone at home to assist you. They will serve as an important role in your recovery. You may require assistance with light housekeeping, running errands, transporting to and from appointments. They may also be valuable to aid you with dressing, managing your medications, and reporting any health concerns to your surgeon's office. It is important to avoid going to the emergency room after surgery unless it is truly necessary. We want for you to be aware of who to call after surgery. Your surgeon's office is open Monday through Friday from 8 to 4:30 with on-call providers available off hours and weekends. Please call your surgeon's office with any concerns of increased redness or drainage around your incision site, any dressing concerns, any severe pain that will not go away with rest, ice, or medications, a fever greater than 101 or any shaking chills, if you develop a new rash without any difficulties breathing or swallowing. And we also want to be contacted if you have sustained a fall that has not included hitting your head. Plan ahead for medication refills and notify our office so that we may address those in a timely manner. You are advised to call your primary care provider's office if you have an illness that is not related to your surgery, such as a sore throat, high blood pressure, or sinus pain. If you are experiencing any increased depression or anxiety, or if you need a refill for your home medications routinely prescribed by their office. Always know that you should call 911 or report to your nearest emergency room if you develop any difficulty breathing or experience shortness of breath. If you have any chest pains, or if you have sustained a fall that has included hitting your head or resulted in extreme pain. Any new rash that is associated with difficulty breathing or swallowing also should be addressed with 911 or reporting to your emergency room. Being well prepared is an important and vital step to a successful surgical experience. You are the most important person in your recovery. Having all of your questions answered will give you peace of mind and set you up for great results. We always encourage patients to come up with a positive attitude and take an active role in their recovery after surgery. If you have any remaining questions following this online education program, please do not hesitate to follow up with us here at the office. We'd be more than happy to assist you. Thank you again for taking time out of your day to participate, and we look forward to caring for you.